So, as after the last video, I said that I had discussed possible options with my nephrologist. So I had opted to go ahead and have a transplant as opposed to dialysis. During that discussion, my nephrologist asked me, is there a particular facility that I would want him to refer me to? At the time, well, first let me just say I'm fortunate to live in an area where we have two facilities that actually perform transplantations, and they're both in the same distance from me. So that wasn't a problem getting there. So I was aware also of both of the facilities, their reputations and everything, but that was pretty much all. I didn't really know anything more as far as the transplantation program goes. So I based my decision on the fact that one is a teaching facility, the other is a community hospital. I thought that the teaching facility would be more up on the most recent forms of treatment. So I said, please refer me to the training facility, the teaching facility. So within a week of the referral from the nephrologist, the transplant center called me up, touched base with me, asked questions, pretty much wanted to set up my first day evaluation. This facility divides evaluation for transplant into 2 days. There's 1 day, the first day evaluation, which occurs, and then the second day evaluation occurs like a month after the first day evaluation. So they called me up to try and set up the first day evaluation. They just said, are there any dates that you won't be able to attend? I said, no, I can attend any date you have. And just remembering, they mainly deal with a lot of dialysis patients, so if you're on dialysis you wouldn't be able to attend the days that you perhaps dialyze. So told them I'm free, just give me a date, I'll be there. They did sign me up, and I think within 2 or 3 weeks of them calling, I had an appointment. They also sent me a package through the mail, and the package pretty much just went over the process, what to expect during the first day evaluation. They gave me some videos to watch prior to attending. So first day evaluation arrives. I go there early in the morning and pretty much meet with the transplant team, or some members of the transplant team. The first person I was able to meet was a financial person, and basically they just want to make sure that you are able to meet the financial obligations that come along with transplantation, whether it be the upon admission, your admission fees, and mainly just being able to cover your medication expenses post-transplant, because once you have a kidney, you're going to have medications for the life of that kidney, however long it lasts. So you're going to have immunosuppressants, and they want to make sure that you are able to afford those medications. So I went through that. I next met with the dietitian, and the dietitian just went over how my diet may change a bit after the transplant, and the main thing there was just being careful of the types of foods that you eat, namely like buffet foods. It's hard to maintain a constant temperature with buffet foods, and with that, if the food isn't kept at a constant temperature, then the chances of food poisoning are increased, and you wouldn't want to have that because you're immunosuppressed. So they said that you might want to stay away from buffet foods, and pretty much with your foods that you have at home, your fresh vegetables and fruit, just make sure that you just give it an extra good wash, get anything off of there. So we pretty much went over that. I also met with a social worker. We just went over social work type issues. Next, I met with the nurse practitioner. The nurse practitioner just did my history and physical, just asked about my medical history and just went over the whole blurb there. Once I completed, once I finished seeing the nurse practitioner, she just said to me that if I have any people that are interested in being a living donor, now is a good time to get them to sign up. So, you know, they have a portal that you can go to and sign up and just explain that you're interested in donating. So she did tell me that. After seeing a nurse practitioner, went to get about 13 vials of blood drawn. Also had an EKG and a chest x-ray performed, and that pretty much completed all of the first day evaluation tests. They said to be prepared to stay there for an entire day, but it actually took maybe about half a day. Once we went home, my husband did go online and started to fill in the donor form. He had no problems. He went in, entered who he's interested in donating for, and just entered all the history and physical questions that they ask. I have two brothers in the United Kingdom. They too are interested in being a donor. My first brother, he was able to enter the data pretty much okay. The only part he had issue with was when it asked for an address. It was pretty much looking for a US address. It wouldn't allow him to enter a United Kingdom address. So pretty much what he did is put my address in there, and then in the little area, he just added my address in there, and then in an area of the form where it allowed you to free text some, you know, a sentence, he indicated that he actually resides in the United Kingdom. My other brother, he started with the initial donor form. In the form it asks you if you'd be willing to receive a blood transfusion. My brother is a Jehovah's Witness, and so he's not willing to receive one, even though he really wanted to donate a kidney. So at the completion of that kidney donation form, it says thank you, but no thank you. If you're not willing to receive blood, then we cannot use you as a donor. Now I say this to say that, you know, I mentioned we have two facilities that offer transplantation. It turns out that the community hospital actually does accommodate bloodless surgery, which means that it accommodates Jehovah's Witnesses that are willing to donate a kidney but don't want to receive blood. So there are techniques out there that can accommodate it, and it's just something that it's worth doing your homework if you have options of facilities and you have donors that are Jehovah's Witnesses. So anyway, that pretty much just summed up my first day evaluation.